Hello everyone, this is Dr. Huma Ibrar. I wish you all a good day. If you are new to this channel, let me tell you that this channel is all about international license exam material and guidance. So if you still haven't subscribed this channel, kindly subscribe this channel and don't forget to click the bell icon. Today, we'll discuss about MCQs and topics of recent Oman license exam OMSB. Before starting, I'd like to congratulate Dr. Syed Asad and Dr. Fajr on clearing OMSB exam in first attempt. And I request you to keep a notebook and pen with you before watching this video so that you can note down important topics. So these were the MCQ topics in recent Oman Medical Specialty Board license exam. Let's start. Number 1, nystagmus, hemianopia, clonus, Ebb's palsy, Klumpke's palsy, chondromalacia, ACL injury, horrible triad, prone knee meniscus test. Kindly note down all these important topics. Let's move towards next slide. Anterior drawer test, carpal tunnel syndrome, baseball finger, fall on hyperflex hand, ventricle beat per minute, interferential current, Fitz maneuver, femoral neck fracture causes which nerve root injury? Let's move towards next slide. Cardiac patient exercise competence test, short wave diathermy, monophasic current. In supraspinatus tendinitis, which modality is used? Led by rigidity. In foot drop, which nerve is involved? Let's move towards the next slide. Arm abducted, forearm pronated and flaccid in 5 years child. Which injury is it? Brachial, radial or ulnar? Walkman ischemic contracture, radiculopathy treatment, pelvic traction. Which virus causes cervical cancer in female? Football player knee, D2 flexion. So let's move towards next slide. Ataxia, eprexia, superficial modalities, severe osteoarthritis treatment, ACL injury, which diagnostic tool is used? MRI or X-ray, etc. These were some MCQs options. Postural drainage for cystic fibrosis and also for left basal drainage. Residual volume, that's I think respiratory residual volume. Diabetic fetus. March fracture site, coxa norma. There were bicep muscle picture and function, static hypotension, delayed soreness due to myasthenia gravis or myopathy, contraindication for TENS, contraindication for patient with radiotherapy for cancer. So let's move towards the next slide. In which shoulder condition a patient is unable to wear clothes? Body planes, Botnier deformity, Sudex atrophy, defined endurance, active insufficiency, median nerve damage, ulnar nerve damage. Kindly note down all these points and important topics and start preparing for your Prometric exam. Thank you for watching this video.